First thing I want to do is thank you for coming and welcome you. Welcome this morning, and this will be where we'll be going through interpreter strategies for effective communication with children and families in health and education. So before we start, as a sign of an opportunity for everyone to show respect, we are going to do an acknowledgement of country. So let me just read this out. Acknowledgement of country. In the spirit of reconciliation, IMS Interpreter Management System acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. Today, we really pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Thank you. But I just want to give a shout out to our IMS team. We take immense pride in IMS and its ability to provide better healthcare through better interpreter management. And today I'd like to extend a heartfelt shout out to our dedicated team who work in the back, typically not up on the screens and things like that, but they work tirelessly to continue to develop and advance and refine IMS while also delivering really exceptional support for our incredibly valued customers. Their unwavering dedication to ensuring everyone is understood exemplifies their passion and commitment. Let's get down to the absolutely exciting thing of introducing our speakers, who are absolutely awesomely beautiful women. And what I'm going to do is just bring in Mireia Perez. I'll just read this out. Is the host of Brand the Interpreter podcast. And she began her career as a certified medical interpreter and has since gained over a decade of experience breaking down language barriers in the healthcare and education. After honing her skills as a medical interpreter in both a general and children's hospital, Mireia spent nearly a decade as a staffed interpreter in a K-12 public education school district, where she championed the vital role of trained interpreters in education. Today, Mireia is the proud creator and host of the Brand the Interpreter podcast. If you have not heard that podcast, after this webinar, go and have a listen. Absolutely brilliant. Where she shares the stories and perspectives of language professionals from around the world. So it's for you guys. With a master's degree in communications and a passion for topics like creativity, personal branding, and strategic communication management in the interpreting industry, Mireia is committed to continue elevating the voices and stories of language professionals worldwide. So welcome, Mireia. We're very excited to have you. Our next speaker is Despina. Thank you. And she is a certified Greek interpreter and translator and the head of the interpreting department of 2M Language Services, a leading Australian language service provider. And as part of her role, she oversees interpreting recruitment, training and professional development, as well as relationships between interpreters and other stakeholders. I just want to mention here that 2M have a 2M Academy. So when we send out the video, we're going to actually send out a flyer around the Academy, just so that this is really good tools for everybody in the industry. So we just want to promote that. So Despina worked for many years as an in-house interpreter in public healthcare and settings and is a member of the Australian Institute of Interpreters and Translators, where she has served in various roles, including the executive board as a vice president for events and professional development. Despina has had the opportunity to organise many events and conferences for interpreters and translators, including the first fully online conference in Australia in 2020. If anyone remembers what was happening in 2020, Melbourne was in lockdown for nearly a year. So that was, and this is where Despina and I are based, and Steve are in Melbourne. Despina, Australia. Ms. Despina is a recipient of the Aussies Paul Sinclair Award 2019 for outstanding contribution to the T&I profession, as well as the Eye and Ear Hospital Allied Health Excellence Award for leading projects that delivered significant improvement for cold patients. Furthermore, Despina is a published author and interpreter, tutor, and research assistant for RMIT since 2018, which is absolutely phenomenal. Welcome, Despina.
Thank you, Karen.
Okay, so that is actually the end of the slides. So I'm going to stop sharing, and I'm going to ask my first question. And actually, Mireia, For us in Australia, what is K-12?
Great question. Thank you. And by the way, thank you, IMS team, and thank you, Karen, and everyone here today joining us for this wonderful conversation. I'm thrilled to be here today. K-12 is, the K stands for kindergarten. Many of our schools here in the U.S. begin in kindergarten. Many actually start in pre-K. So it could be pre-kindergarten all the way through 12th grade. So kinder.
Excellent, excellent. So I know we have something similar, but I notice, although even different states, some states start, although I think that's stopped now, they would start kinder at a different age, and it was prep, and Melbourne it's prep, and there's all these different scenarios. Okay, so I was actually going to ask another kind of cheeky question. Despina and Maria, if you could think of your favourite food as a child.
Okay, thanks, Karen. It will have to be homemade pies, like spinach and cheese pie or cheese pie that my mom used to make.
Oh, that sounds awesome. Was your mum a good cook?
To me, she was, yes. But, this is very subjective, I guess.
Okay, Maria, what was your favourite food?
I was just going to say, unlike the spina, it wasn't homemade food. And that's because we always had homemade food. And only every now and then we were able to eat pizza. And I know it's like, really, pizza? But it was just like the best thing ever because, it was always out. It was always like homemade food that we had. And so whenever we could get pizza, we were super excited. We were a family of, pretty big family. Actually, it was 4 siblings together and then plus my 2 parents. So yeah, we couldn't always eat out. When we did, it was definitely pizza, my favorite.
Oh, that's awesome. Yeah, I would completely understand when you got those large families. It's an expensive venture sometimes. So let's just we're talking about children and families, and sort of Despina. We've deliberately chosen these 2 fabulous speakers. Despina comes from a health perspective, and Maria has really had a major focus in education. And as a technologist and as a company that wants to provide services for both sort of sectors, the question is how much is there a crossover? What are the peculiarities between each? Just unpacking a little bit more around those 2 very key sectors in our countries. So one of the things, first of all, which working with children, so the importance, like how do you work, and what could be the scenarios that you could find yourself interpreting in. So Despina from a health perspective, and Maria, if you could talk from an education perspective. Despina, do you want to go first?
Yes, absolutely. So interpreting for younger children or interpreting for children in healthcare is not really dissimilar to interpreting for adults or for anybody else. However, the difference is when interpreting for younger children. So in my career as an in-house interpreter for a public hospital here in Melbourne, Australia, I got the opportunity to often interpret for a specific clinic, which is called the Cochlear Implant Clinic, where the patients in that clinic, they receive their cochlear implants that enables them to hear and speak and communicate better. This is a long process, so it's not just a surgery and everything works the following day. It's a year-long process, usually for everyone, for children or for adults. So I had the opportunity to interpret for Greek-speaking families and their children who were the recipients of cochlear implants. And the difference is really that I, as an interpreter, need to be okay and welcome to be interrupted, to be around many people. So, it can be both parents, they can be the siblings, they are present at each and every appointment. And there's a lot of noise associated and a lot of interruptions, and the toys, they might be flying around. So there is, yeah, it's pretty different to other consultations with adult patients where things are, of course, a lot more settled. There's not so much noise or toys associated. So, like the other professionals, for example, the surgeons, the nurses, the audiologists, the speech pathologists, they need to repeat themselves. The same goes for the interpreter. It's a lovely experience if you enjoy being around all of that, the noise, the toys and everything, and very rewarding as interpreting is as a whole.
Yeah, I can imagine. Maria?
Yeah, the interesting thing about it, and what perhaps many individuals maybe aren't familiar with when it comes to interpreting in education, particularly here in the US, is that this is where sort of like the roads cross. There's a crossover in terms of the context. So if this child, for instance, is going to the medical facility to receive these services, they still have to go to school, and these children have to receive very specified services. So accommodations that are made here in the U.S., it's through a program called Special Education Services.
Okay.
And if they require accommodations, they have to go through a whole process of assessments and meet the criteria. Then guess where that terminology also ends up? All of those specialists, the social services, the audiologists, the speech pathologist, all of those individuals are also in the room in a school health setting talking about the educational environment of the student. So this is why it's so important, and I love talking about interpreters in education, particularly qualified and trained interpreters in education. Because if it had not been for my background in the medical setting and having started my career as a certified medical interpreter, the terminology that I came up with when I first started in education, it would have impeded my ability to really accurately interpret for our families, because I would have been stuck on, why are we using such terminology here? Why are we using medical terms? It's education. It's supposed to be ABC 1, 2, 3, type of terminology. Why are we talking to audiologists, cochlear implants, and all of that stuff? So yeah, it's very important. This is why there is a crossover between the two worlds, and why I'm always talking about education as an important specialization, because we do come across difficulties such as that.
That's a really interesting crossover, and that was sort of like one of the things. What I was wondering, is there crossovers? Are there two specific? I am health, I am education. But that's so cool that that health background prepared you for education. And that's a good point too, because there are a lot of those services in our schools, and psychologists, counsellors, all those sort of scenarios. So that's really excellent. Now, the next question is around the complexities. So I'd love you guys to unpack. I think in health, it could be incredibly emotional, and you're the bearer potentially of bad news. So to me, I'd probably go run and hide. I can't do it. So that I think just the braveness and the which it would amaze me, and just curious in education as well. What is the where does it get messy? I suppose is a good question, Maria. So if we can start with you, Maria, with that one, where does it get messy? In interpreting in education, or just in the whole infrastructure of providing language services?
Yeah, I think that depends on which angle we want to look at. When we are talking about students, think about what makes up the student as a whole, and really what that would be their entire environment, and that includes their family, that includes their household and whatever is going on in there. So when there's certain issues, academic concerns, let's say that the child is not making the academic progress that they should be making at a certain grade level, a team of educational professionals will come in to try to identify what that situation is, and sometimes what they unpack can be a variety of different things. And while we're talking about education, remember there is a host of different resources available for families in an educational setting for a reason, because there are just so many elements that make up the child as a whole. So it's definitely the environment, the academic environment, but it's also looking at the family and the surroundings and what the household potentially is like. So if this child is having some, let's say, we deal a lot with homelessness where families don't have a place to live, and so there's certain criteria for that. And if that comes up during a conversation, it's very emotionally charging, because families don't always necessarily want to admit that. We're dealing with very vulnerable populations already as it is, and so if for some reason that comes up, these situations, could become very emotionally charged, with families crying, with students, just sharing their story about what's going on in their environment. So there is actually quite different varieties of complexities in terms of when it comes to emotion in educational settings. Perhaps not the same way in which we would think about maybe in the legal or in the medical field, in which it's directly correlated maybe with prison, or in the medical field having to do with life or death. But there's definitely situations in which those elements of the complexities of family issues come into the conversation, because it's affecting the child's academic progress. And so anything and everything can come up during these types of meetings in education.
That is, and I think pertains to interpreting as a whole, right? So, and completely agree with what you're saying. And it is very similar, obviously, in health. And there are even more complexities, if we wanted to go deeper, that don't have to do necessarily with the dynamic of the consultation or the news shared during, the conversation. They also have to do that our role as interpreters, by those that are requiring our services, it's not known, so they're not aware, they're not familiar of what it is, what an interpreter does, but also of what an interpreter isn't, or what an interpreter does not do. So when it comes specifically to health, this can lead obviously to serious issues that, left unchecked, can also undermine the necessary trust and rapport that clinicians need to build with families and their children in order to obtain the desired health outcomes. In certain cultures, the family, immediate and or extended, takes care of the member's needs, in this case the child's, and they also act as interpreters on their family's behalf. So these ad hoc interpreters come obviously with no training and expertise, no qualifications, and often with their own competing agendas, which are different to what the healthcare system or the clinician is trying to achieve. So often what takes place in these situations is anything else but interpreting. It can be summarizing, adding, omitting, or plainly distorting. So this can also stem at times from a desire to protect the family from bad news, such as a bad illness or a chronic condition. As we understand, all of these can have catastrophic, consequences, because potentially it means worse health outcomes, worse care management, readmissions at the hospital, extended length of stay at the hospital or the facility, dissatisfaction of family and carers with the healthcare system, mistrust, non-adherence to the course of treatment, malpractice suits, and so on.
Mm.
So, as a result of cultural biases or lack of awareness about our role as interpreters, we can often also be treated with skepticism. So, families don't understand why a family member or a friend cannot do the interpreting. And sometimes we can be faced also with open hostility,
Mm.
as families might be reluctant to and unwilling to disclose information to someone they consider to be a stranger. See the difference, a stranger, not a professional.
Mm.
So, and at times, the same lack of awareness is shared by the clinician who also doesn't understand the interpreter's role or why people can't communicate well in English, especially if they've been in the country for many years or quite some time. So, our goal as interpreters is to explain our role to both the other professionals, the clinicians in the healthcare system, and the loudspeakers, the speakers of this language other than English, and maintain throughout the consultation not only professional conduct, but also competence in delivery. It is my experience that families who started with being unaware of the role of the professional interpreter and clinicians alike can themselves realize when working with a professional interpreter, the difference between them and an ad hoc interpreter, and admire the skills that go into what we call expert delivery. So it's a win-win.
Yeah, yeah, exactly. And just sort of something I would say that potentially, although when you're at the on the journey of a cochlear implant dyspnea, that would have been a longer journey. But I'm wondering between with Maria, with the schools, you've got kind of the same group of people because you're on staff or they use the same suppliers, so there's a consistency of people. Whereas with health, you've got potentially different doctors. You don't have necessarily the same doctor all the time, or there. So to me, would you be repeating Despina, the purpose of the interpreter, to a lot of people? Whereas with Maria, you can within schools it'd be an easy, you wouldn't have to repeat yourself so much, which is, yeah. So Maria, is there that situation where you have that consistency of people that you work with?
I think the answer to that is it depends, and it really depends on how robust the language access plan of a school district is. So what I mean by that is if they have policies in place that bring in different stakeholders. For instance, if they have in-house interpreters, then yes, the answer to that would be that we are also making connections with the educational staff, and very likely that unless we're working with a new teacher or a new specialist, then we acknowledge the presence of a new individual and we give our introduction and a little spiel for the new person. But I think with the parents as well, it's just a quick reminder, allowing them to
Yeah.
remember what our role there is going to be. Now, if they have, like they should, a connection with the a language service provider to be able to support the languages of lesser diffusion, and you've got contracted interpreters that are coming in, then the contracted interpreters would hopefully continuously be providing that basically, their interpreter role every time that they walk in, because they're not going to have the same necessarily consistency with the families and the staff as an internal staff member would.
Yeah.
So
Cool.
the answer is it depends.
And just with what sort of size would a typical school district that you would be servicing, how many schools are we talking, or how many students?
Honestly, throughout the U.S., they completely vary. You could have anywhere between 22,000 students in one
Whoa.
school district, probably around 20 or so schools. It just depends, because here you could be a school district that services K through 12, or it could be a school district that only focuses on elementary schools, so the primary levels, or it could be a school district that only focuses in high schools. So
Okay.
I know that everybody, hates that response, but it depends.
Yeah, no. That makes sense. So, Despina, did you want to speak to anything in that regard?
Well, actually, I was going to say, yeah, I completely agree. It depends whether you are, assisting the same clinicians and the same patients, children with their families coming in for their appointments, or you get to meet, obviously, new clinical staff and new patients. Not everybody keeps coming, for example, at the hospital, and that's a good thing. So,
Yeah.
yeah, to those that you have not explained your role before as an interpreter, it's absolutely crucial that you do. This will save you like unnecessary back and forth and uh, unnecessary, I guess, behavior, because people just don't know what they don't know if they haven't worked with an interpreter before, and it's really important. It shouldn't take long. It's really important to say that you are there to facilitate communication and to repeat accurately everything that it is said during the consultation. And why is that very important? Because, and as we briefly touched earlier on, sometimes as interpreters, in healthcare at least, we are called to deliver bad news, right? Bad news of sickness, of a chronic condition, a difficult procedure, a bad prognosis, all of that. So again, for many cultures, just referencing words such as cancer or chemotherapy or death can be a big taboo. So, and this can make our role as interpreters even more complicated. It is not uncommon to be asked before stepping into the consultation room to avoid, say, certain words because they're considered to being bad omens or bringing bad luck. So there and then or before that, it'd be very opportune to stress that our role as an interpreter is to relay accurately whatever it is said.
Yeah.
And if something they don't wish to have interpreted, it should not be mentioned in the room. To both parties, that is.
Okay, that's amazing. What is the cost of not providing interpreters? Maria, do you want?
Yes, and actually, just to add on really quickly with the last question, I think also what's important when we are consistently being consistent, that's key word there, of providing the same level of service as qualified trained interpreters. It creates almost this, this expectation and understanding of I'm working with a trained professional because I see that they do the same thing. Every interpreter that I work with will come in and basically set the stage. So if someone walks in and doesn't do that, if for someone that has been consistently working with trained interpreters, they will recognize that. And I say that because we've seen this in education where we're working with everyone and being very consistent with the way in which we deliver the service. And when someone steps outside of that, maybe not necessarily part of the team, but someone was called in last minute, let's just say, and doesn't sort of follow the procedure, then they're like, was that one of our interpreters? Or was that someone from the outside? They'll recognize that. And I think that's beautiful to see that individuals expect a certain level of professionalism from an individual that is a professional. They should be, at least. And if even just that introduction isn't given, that somebody's spidey senses are saying something's up here with this interpreter. So I just wanted to make sure I added that, because I think that's super important for in terms of why we should be consistent regardless of the setting or the people in the room. Of course, the introduction is going to maybe change a bit, but I think in an interpreter introduction, just to set the stage should always be present. And now I forgot, thanks to that ramble, the question you asked.
No. Well, no, actually, let's stay with training. So the importance of training. So obviously you've just pointed out there, Maria, that the importance of training is for consistency for the person that's utilizing the services. So we've got consistency, and one resounding thing I hear continuously is professionalism. And I, from your podcast, Maria, one of the things I hear a lot is that someone will want to use a staff member that is bilingual, or they'll want to use the family. But when they experience using an interpreter, a professional interpreter, they go, "Oh, that was different." and I think
Yeah.
you say that's how it should be.
Yeah, that's
So
training. It's usually what follows. I go, wow, that went so well. Oh, that's training. That's thanks to training. I always try to throw those keywords so that they recognize it's not because I speak two languages. It's because I deliberately went through very specific training to get us there, so that you feel like you were talking, like you were speaking directly with the other individual, with the parent, in this case, with the family, and don't necessarily feel like there's, you're getting stuck in the communication flow. And I deliberately, by the way, just throwing this out there, really choose to use working with interpreters as opposed to using interpreters,
that's a
just
good
because
pickup.
that's exactly what it is. It's
Yeah,
it's
it's
a
good.
collaborative work process between everyone involved in order to ensure that communication flow. And so I deliberately definitely use that instead of use an interpreter, so that people sort of just with terminology begin to identify the process and the individuals that they are working with.
That's awesome. That's really good. Despina, did you want to speak to that?
Yeah, and also for us here in Australia, we are trying really, to move away from using an interpreter is engaging the services or engaging
Right.
an interpreter. I know
Yeah.
it has more syllables, so for Australians it's a little bit difficult. We hate, the more syllables. We don't like it. We just try to make words shorter. But it's really important to emphasize all that goes into the making of a professional interpreter to
Yeah, that's good.
differentiate between the bilinguals. So a professional interpreter is someone who has qualifications in interpreting studies, certifications, including specialized health certification or legal certification, as well as expertise. So in other words, an interpreter is different to a bilingual with a self-purported knowledge of another language and another culture. And also, an interpreter is someone who is required to adhere to a code of ethics and a code of conduct for interpreters specifically, which references principles such as professional conduct, competence, accuracy, impartiality, confidentiality, just to mention a few.
Mm.
All these principles, what they do, they safeguard the end user's rights when working with interpreters, just as they form part of a shared understanding when working with other professionals, such as doctors or lawyers. We take that for granted, but the same goes when working with interpreters. These codes are there to safeguard the end user's rights when they work with professional interpreters.
That's good.
So in Australia, when it comes to certification, which is really the interpreter's license to practice, we have a quite robust certification system through the National Accreditation Authority for Translators and Interpreters. So the National Certification Authority grants license to practice or certification, as it's called, and or recognition for rare and emerging languages as a result of passing an exam after having completed interpreting studies specifically. So this certification or recognition needs to be reassessed every 3 years, like with all other professions, and it is subject to professional practice and evidence of professional development. Very, very important for every profession, same with interpreters. The same system, certification system, will soon be mandatory for the public sector in our neighboring country, which is New Zealand.
Yes.
As a matter of fact, as of July 2024, so this is really exciting.
Yeah. Vinaya, I'm not sure if we have a body called NATI. And predominantly you need to be certified. And NATI have just expanded into a neighbouring, as Despina said, which is a neighbouring country, which is New Zealand. Now, there are several sort of certification bodies within the US as well, Maria. Is that correct?
Absolutely, for different sectors, yes.
Yeah.
Except
Okay.
not an education yet.
Ah, that's interesting. Oh, I can see you have a goal.
Well, I think it's just an entire community, if you will, of it's an army of
Yeah,
interpreters in education that have a goal. So I'm just sharing the goal with them.
yeah, that's amazing. So, and Nati is more generalist. It is across all sort of sectors. Whereas Maria, are you saying that if you're in health, then there are health certification bodies that you go to for certification?
Yes.
Okay.
So yes, here in the US, there is certification, and I don't want to speak too much on that because I'm definitely not the expert in each of these associations or certifying bodies, but the legal setting has its own process, and I believe it's by state. Don't quote me on that.
Yeah.
And then you've got the medical setting that they have associations or certifying bodies that certifies medical or healthcare interpreters. And then what we're pushing for with the support of, we actually have two national associations that have been born in the last few years, with the intention to professionalize the role of interpreters and translators in the field of education, and then eventually be able to begin the process of creating a certification.
Oh,
So we don't have that currently for interpreters, which is why there's so much difficulty with being able to bring in qualified trained interpreters. But the beautiful thing is that interpreters from other specialty fields are sort of coming into education and then seeing the hot mess that there could be and saying, oh man, this is actually not as easy as I thought it'd be. My certification can definitely play a role here. So luckily, which is how I ended up just stumbling into education. I came, like I mentioned, it was all medical, and
yeah.
in my just my innocence of just when I just started in the interpreting field, I thought everybody knew the difference. It didn't matter what sector. I mean, I was holding my certification, so everyone knew that how to work with an interpreter. And then it was like, no.
Yeah.
So yeah, it involved much more than just walking in as a trained interpreter.
So that it's excellent that that's the aim with certification for the education sector, and we wish you guys Godspeed. And I suppose so. Now that we understand, so definitely with what is the cost of not providing interpreters, I think we can even sort of potentially swap in what is the cost of not providing qualified, certified interpreters. So, Despina, would you like to talk to what is the cost of not having the professional ones, interpreters?
Of course. I mean, other than the obvious cost that we mentioned earlier, to help parents, families, and their children to develop skills and strategies that aim to support the child's health, well-being, and developmental needs, which is huge in itself, right?
Yeah, I can imagine.
But the other aspect of it is the actual cost, the cost in money, in dollars. So here in Australia, one of the government departments has exactly quantified how much the engagement of unqualified interpreters or the non-engagement of professional interpreters costs annually the Australian economy. I cannot share the figures because the report is commercial in confidence, but I can say that it is a very, very big figure. So, and we're talking about millions of dollars that each year the Australian taxpayers have to fork out, have to pay because of what is titled as suboptimal interpreting. Again, engagement of unqualified interpreters or non-engagement of professional interpreters. So the cost, is huge, not only in terms of everything else, which is, of course, super important, but in terms of dollars as well. So hopefully, all these initiatives they're gonna get the point across that there is no other way, and that it's really no excuse with all technologies available today when it comes to interpreting, to non-engage professional interpreters when they are needed.
Despina, is that report across sectors, or is it just for health?
It is across sectors.
Okay. Will it be publicly released?
I believe so, because of course there's a lot of work that went into putting it together, and it will have to be released. I'm not sure when, obviously, hopefully soon, because the findings are really eye-opening.
That's awesome. And that kind of information for your language service managers that have to go into, the hospital management to say, I want budget, we need to improve, we need training, we need more translations done rather than just, a subset of 3 or 6 languages. We need to recognise rare languages. So that kind of report hopefully will give them a platform to show the importance of it all. And I think as well, Despina, can you tell us? And we will do an email out to everybody who's registered and just to all our customers and clients. Despina, Maria, is there anything sort of similar that is in the States that you know
of? In terms of
a report
study?
of not the cost of not using interpreters.
I couldn't tell you. I'm sure there's something out there, but as it specifically relates to education, it's funny because I actually, prior to joining here, was out in Capitol Hill today advocating for not just funding, I know, through the American Association of Interpreters and Translators in Education, quick shout out, they hosted this advocacy day in order for us to be able to go speak on this particular topic, in requesting for money, but not just for money, and being able to request for research work behind the correlation between the provision of language services and the engagement of families that speak a language other than English in their child's education, because that's something that we don't have, is just being able to see, number one, is it measurable? How is it measurable? And what does it do? How does it impact our multilingually diverse communities in schools? How does that impact their engagement with the study, with their students' education? So I think that's definitely something that is absolutely needed. That's why we're advocating and we were asking for it today. But in terms of just research, I think depending on the sectors, I'm certain there's absolutely, a lot of data reports out there that measure such a thing, for sure.
Yeah. Oh, well, really, again, hope that that's a successful trip to Capitol Hill. That would have been, that's fabulous. So I think one of the things that we've discussed, the sensitivities, like and I think Despina, you mentioned confidentiality. There's the being able to share bad news, being able to work with lots of different children. I can imagine sort of that scene where you're talking to the parents and you've got kids running around and the parents distracted, but this is incredibly important things that you need to talk about. So working in distractions. What I would love you guys to discuss is the importance of self-care. Because I think you're on the front line a lot of the times, and people will recognise the people like ambulance drivers and doctors and what they go through, but potentially there's an interpreter that's been engaged by their side. So how does that interpreter ensure that they have self-care?
That's a very good question and a very good topic. So usually interpreting, let alone interpreting self-care, is an afterthought. Unfortunately, it shouldn't be. So we, as interpreters and language service providers, we are trying actively to change that. So what we've done through our specialized training, which you mentioned, Karen, earlier, is delivered mainly through our training app, the 2M Academy, which is the first free training platform for interpreters and translators in Australia and New Zealand. So we've put together, for example, a year-long training in upskilling interpreters in palliative care settings. So this training was aimed to equip interpreters to feel more ready and more comfortable to undertake these assignments, which take place in a highly emotive and sensitive domain, such as palliative care. But this training, what was different about it, it is interpret-centric. So a big part of it as such is dedicated to self-care, because research has shown that repeated exposure to trauma will lead to vicarious trauma. It's just what it is. So we need, as interpreters working in, sensitive settings, to have up our sleeve techniques, ways and methods, and referrals and organization where we can refer to when the time comes, because we're going to be able through this training to recognize the signs of vicarious trauma or compassion fatigue, whatever this may be, or even burnout as well. This is another big issue within interpreters. And then take the necessary steps. But again, with no training, no tools, it's so limited what we can do. So this is a shared commitment. The well-being of interpreters is a shared commitment among all stakeholders. Obviously, the interpreters themselves, the interpreter trainers, the language service providers, and everyone that is in the industry.
That's good. Thank you, Despina Maria.
Yeah, when I talk about this particular topic in education, I always say that we're, as interpreters, we're always advocating, not directly, don't come at me for the ethical piece, but meaning advocating for other people, because that's really what our job is, right? And being able to advocate for their communication component. And so we forget, though, to advocate for ourselves. Right? We oftentimes get into the field because we want to help, we want to support, we want to give back to the community, we want to make sure that individuals' voices are heard, and then we forget about us. We forget that even if they're asking for please this last minute, and your brain's been fried because you've been interpreting for so many back-to-back meetings that have been hours long, and you're tired, your heart wants to say yes. And oftentimes many interpreters do say yes, and we forget to set those parameters. And I think that really what the reminder, for me at least, being able to share when we talk about self-care for interpreters, is being able to not just set the parameters, but honor them so that you can continue to be of quality service to the individuals. It's not that you say no because you don't care, which is oftentimes, sometimes what we internalize is saying, I really would like to, but I simply cannot. We feel like that's it, that person will never ever get help again. But in actuality, what we do is help support the understanding of having language access, or offering the language services at the forefront, not an afterthought. Because otherwise interpreters might not be available, or we've already scheduled four interpreting assignments during the day that are almost 2 hours long, depending on the assignment. Individuals don't necessarily think of that. They're thinking about something quick, we need an interpreter now. And at least in the educational setting, I know it's a little bit different, obviously, than in the health setting. But I think that it's more about setting those parameters so that we can continue to provide the quality service that the families that we help and we service deserve. And if we are at capacity, if we're not there because we forget about ourselves, then we won't be there for the long run or the longevity, because we don't think about ourselves. And so
Yeah.
I know out here in the US, at least, there's another wonderful individual, another healthcare interpreter that's doing, I think that she's leading work in this actual topic. Her name is Andrea Henry, if anybody wants to look her up, about vicarious trauma, mental fatigue, things
Awesome.
of this nature that are very important for interpreters in healthcare settings. And they're actually doing some pretty gnarly research behind that. If anybody wants to look her up, I'm sure she's out there sharing a lot of this information.
Yeah, what we might do is grab that information off you, and then when we send out the video, we'll send some other links around that. That'd be fabulous. We've got a question here. What about when multiple languages are required for families, such as sign language and spoken language for the same meeting?
Yes, absolutely. And this happens often in the cochlear implant setting, in
Oh,
that
yes,
clinic
yes,
specifically. So it's not unusual for spoken language interpreters to work with sign language interpreters. So here we have the Australian Sign Language, so it's called Auslan. So it's not unusual to work with spoken and sign language interpreters for the same consultation for different members of the same family. And it's actually really good because usually as interpreters, we work in isolation. It's only one of us, in the community setting, so healthcare, legal, courts, tribunals. But sometimes when you work with other interpreters, it can be really a good experience, not as isolating professionally as an experience. I mean, conference interpreters, the other side of interpreting, which is not community conference interpreters, they usually work in pairs. But for community interpreters, there's usually these opportunities that get to work with other interpreters. And it might be similar to education, because sometimes with us, Mireia, here in Australia, for educational settings, for example, two spoken language interpreters along with sign language interpreters can be engaged to deliver, an information session in other languages. I don't know if it's the same also in the US.
I mean, the need, I'm sure, is actually out there. It's whether or not the educational agency is equipped to handle such requests. I think that's really the work that is being done, to be able to emphasize the need for creating something that's robust to the level of understanding the families that they're serving. So if the families that they're serving in that particular community have a need for ASL interpreting, and in addition to other languages, then that means that that school district should be looking for how to service this should the need arise. Is there a need? Absolutely. I think different pockets of community have a combination of it's linguistically diverse, so that includes sign language and spoken language. It just really depends on the school district, and I go back to how robust the language access plan and policy that they have in place in order to address such a need.
Awesome. If there's any other questions, just share them out. But just on, we're getting close to finishing up. Is there anything either of you would like to share?
I'd like to just add, there was a question earlier with regards to what is the cost.
Yes.
That I didn't really get to say much about, and I think that for education, which is why there's a push for highlighting the role of trained and qualified interpreters in this particular field, as well as translators. I don't want to leave our translators out.
Yes, yeah, good point.
Of that, but I think that for us, we're servicing the next generation. So it's a next generation of multilingual learners that is potentially going throughout their educational career, if you will, without that direct involvement of their parents, the way potentially their other, their friends who do speak the language, whose parents do speak the language, have that engagement. And our multilingual learners perhaps do not, because you have a whole pocket of families, a whole group of families that are not engaging because they don't understand what is happening. So what's the point of showing up if I don't understand what's happening? It's not that our families aren't interested in getting involved. It's that welcoming, that sense of I understand what is occurring, and therefore I can actively participate in your education. That element is missing currently because we don't have the structure, we don't have the infrastructure to be able to support the families. So the cost for us in education is not necessarily monetary. It's more of the approach of the individuals that are being left out. They're being left out in the sense of, I'd love to be able to take part in these conversations. When a school district asks their community for feedback on where to place the money, our English language learners need some of that money. But if their families cannot participate in that back and forth process of feedback, how are they supposed to advocate for funds to be allocated to their students? There is no ability, no open door. So I think for us, it's the loss of engagement of an entire group of families that don't have the opportunity to participate because the opportunities aren't given to them. So that for us would be the loss in education. That's what I wanted to add.
No, and that's absolutely fantastic, and it makes so much more sense that it's a bit of a tricky situation if you can't join in because you're not speaking the same language. You have no voice to a certain extent. So this is giving a voice to these people, which is incredibly important. So I just want to thank you both. I really thoroughly enjoyed speaking with you both, and you've added so much to this conversation. We hope that you all become huge podcast followers with Maria, with Brand the Interpreter. And then that also you definitely look at the 2M Academy. There's lots of, just the fact that you've got a year-long training around palliative care is just fantastic. And I can imagine, that like if you're in the legal arena, education, like that kind of training is so important. As I've said, we'll be sending this out to everybody, the video, as well as like all the good, which I better write down very quick. As soon as I finish this, I've got to write down what I've got to chase you guys for. So help me remember. And I just want to thank everybody for attending. It's been fabulous having both Australia and the US represented here, night and day. I could almost technically say it's night and day. And so thank you very much. You guys have been brilliant.
Thank you. Thanks, Karen, for the opportunity. Thank you, Mireia. Thank you to the audience. Thank you so much for today.
Yeah. Thank you. Thank you so
Cheers.
much.
Bye.
Ciao.
Thank you. Bye.